So we will continue the session. We reach up to the hemoglobin. So the red blood cells, as we said, it is a sac of hemoglobin. And we know that the hemoglobin is the one which is used to transport oxygen within our body. It is considered from the heme and the globule, the hemoglobin. So the main is containing iron, containing protein, and bind strongly but reversibly to oxygen. So it will attract oxygen in the respiratory system and it bind with them. So it has an affinity to oxygen, so it can attract the oxygen and bind with it strongly, but also it is a reversible, so it will be released when it is reached the blood to the body cells in order to give it to the cells. Each erythrocyte has 250 million hemoglobin molecules. So imagine that huge number of hemoglobin which is there in each blood cell. 250 million hemoglobin molecules. It is a very huge number. Each hemoglobin molecule has a 4 oxygen binding site. So it can bind with 4 molecule of oxygen. So see also the huge amount of oxygen that it can be carried out by the hemoglobin and by each cell. So one red blood cells can carry about 1 billion molecules of oxygen. Imagine those numbers. So it's a very huge number. The more hemoglobin in the cell is the more oxygen that it can be carried out. So when the more molecules of hemoglobin in the blood cells, the capacity or the ability of the blood cells, it will be more to carry out to carry the oxygen. So normal hemoglobin is in most of us it is from 12 to 18 gram per 100 milliliter of blood. So if we are taking 100 ml of blood from a person, it has to be within this range in order to consider it normal. If it is less than that, it is considered as anemia. It might be a mild anemia, or it might be, if it is less than 10 or less than 8, it will be a severe anemia. If it is more than 18, it is considered a polycythemia. Also, so in our body, hemostasis is there. There are ranges for everything. And if it is below that range, it will lead to a disease. If it is more than that range, also it will lead to some certain disease. We will come to that. In men, usually it is more than in females. So in male, it is more than females. So in male, it is around 13 to 18 gram per deciliter. In female, it is less than that. So it might be 12 to 16. The difference, and due to the physiology of the body, the normal physiology of the body, especially after puberty. So menstruation will be there. She is losing some blood due to that. This will affect the hemoglobin of that. So this is about the hemoglobin, and imagine the number of the huge number of ions binding or the ability of the blood cells to bind with the oxygen. So it is nice to know here, and it will be discussed later with adult health, that the hemostatic imbalance, which is anemia. Anemia, it is low hemoglobin will be there, so there will be this decrease when hemoglobin is less. There will be decrease in oxygen carrying ability of the blood. So it will decrease the red blood cells, or inadequate hemoglobin, or abnormal hemoglobin. So anemia, either it is decreased number of red blood cells in our body, or inadequate hemoglobin. The number of the cells are normal, but the amount of hemoglobin within the cell, it is less, which is what we call it microcytic anemia, or abnormal hemoglobin, like in case of sickle cell anemia. So the hemoglobin is having some defect in its formation. That defect, it will lead to the cryopside formation, that the cell, when its lack of oxygen is there, it will be like a C shape. So it is the sickle red blood cells, and this is the normal blood cells. This is due to protein, due to the hemoglobin formation, due to the link of the amino acids that forming the hemoglobin. By this, it will interfere with the transmission of the blood cells in the blood vessels. It will be stuck to the blood vessels, it will closing some minor blood vessels. Because of those who are having sickle cell anemia, they will have severe pain due to ischemic changes, due to loss of oxygen, and due to obstruction of some blood vessels, and the cells that supplied by that blood vessel is not taking it is need from oxygen. The leukocyte, which is the leukocyte, it is which type of the blood cells? What we call it?
White.
It is the white blood cells. So the white blood cells, or the leukocyte, they are the only complete blood cells. They contain a nucleus and organelles. We said that the red blood cells does not have nucleus. The platelets also doesn't have a nucleus. So only the white blood cells is having a nucleus. Form a protective or movable army that help to defend the body against damage or against disease. So it is the army within the body. So they are fighter. They are fighting any change in our body. They are detecting any abnormal cells within anybody, within our body. They are detecting bacteria, detecting virus, and attacking them. So they are the fighter within our body. Form protective, as we said, they slip in and out of the blood vessels. So they can be seen outside the blood vessels, but the red blood cells, they cannot escape from the blood vessels. If they are escaping, it will be clotted. If the red blood cells are coming out of the blood vessels, it will be clotted. It will be used. But the white blood cells, it will come out from the blood vessels in order to fight the microorganism and to fight virus outside the blood in the tissues around the cells. And also, the purpose of that, whenever sometimes we are getting some injury, that injury there will be a tissues which is destructed. That tissues which is destructed, how we are getting rid of it? We are getting rid of it through the macrophage, through the white blood cells that escaping from the blood vessels, and it will take those useless cells or destructed cells and engulf them, and then digest them and making them as a host product in order to be taken out of the body. So they can also locate the area of tissue damage and infection by responding to certain chemicals, which is the positive chemotaxis. Whenever there is a damage or whenever there is a bacterial infection or viral infection, that bacteria or virus or injury, it will lead to some destruction of cells within our body. That cells, when it is destructed, it will start to release chemical substances. That chemical substances, it will attract the white blood cells to the area, and it will attract more blood supply to the area. In order to get rid of those destructed cells, in order to fight the infection, in order to build a new tissues. Did you imagine what will happen? When any destruction due to bacteria or virus or any injury, there will be some destructed cells. That destructed cells, it will release chemical substances when it is destructed. That chemical substances will go with the fluid around, it will go with that, it will be absorbed by the blood, so it will attract the white blood cells to the area in order to fight if infection is there, virus is there, bacteria is there, or even if the cells itself that is destructed, in order to engulf them and in order to rebuild, to clean out the area and rebuild a new tissues, in order to let the body to build a new tissue. So the leukocyte level in the blood, the normal leukocyte, it is from 4,000 to 10,800 cells per cubic millimeter. So this is the normal amount of white blood cells within our body. If it is coming more, in this case, it is an indication of infection. As we said before, when they expect infection is there, the first thing that they will do, they will start with taking blood sample and CBC, looking for the white blood cells. If white blood cells is high, it means that infection is there. So abnormal leukocyte level, also leukocytosis. Leukocytosis above 11,000 per millimeter of cubic millimeter generally indicate an infection. In the other hand, if it is lower than normal, we call it leukopenia. Leukopenia, it means that it is less than 4,000, which is abnormal leukocyte level in the body. So the abnormal low leukocyte level commonly caused by sometime it might be certain drug. When certain drug is taken, it will lead to leukopenia. It might be due to bone marrow depression. It might be to due to exposure to radiation, exposure to chemotherapy, exposure to toxic chemicals. All of those, it might lead to leukopenia. We said that we have two main types of leukocyte. If you remember from the previous lecture, that a granulocyte and agranulocyte. That one which has that pigments inside the cytoplasm, it is called the granulocyte, and those one that doesn't have those dots or pigments that we cannot see it in their plasma, it is a granulocyte. The granulocyte, which contain granules, as we said, it is three types: the neutrophil, eosinophil, and basophil. The lymphocyte, the granulocyte, it is the lymphocyte and monocyte. Each one of them, it is on function and it is concentration. So from 40 to 70% of the white blood cells, they are formed from neutrophils. So neutrophils are forming the most component of the white blood cells. So it is around 40 to 70%, which is 3,000 to 7,000 per cubic millimeter. So it has multiloided nuclei. If you see that there are many nuclei. The eosinophil, it is from 1 to 4%, 100 to 400 per cubic millimeter. Blue-red bolybid nuclei, so bolybide nuclei. So it has two nuclei. The nuclei is divided to that. Then the third one, which is the basophil. The basophil, it is from 0 to 1%. So either it is not there or it is 1%. So it is from 20 to 25 per milliliter. It is U or S-shaped nuclei. So the nuclei, either it is a U-shape or it is S-shaped nuclei. Rare, it has histamine containing granules. Histamine, do you know when the histamine is released? في حالات ايش؟ يزيد عندنا الهستامين. الرجي، حالات الحساسية، التحسس. لا لا شيء ثاني. تحسس إذا قرصت بشغلة أو أخذت علاج and you are sensitive to that drug or any certain substances. Sometimes those who are sensitive to fish or to so they will develop some rashes. So this is due to release of histamine. Lymphocyte and monocyte, this is from the agranulocyte, which has here no granulation within the plasma. The lymphocyte, it is around from 20 to 45%, from 1,500 to 3,000 per cubic millimeter. It has a large dark purple nucleus. So the nucleus is covering most of the cells inside the cells. It is a large nucleus. The monocyte, it is from 4 to 8%. It is from 100 to 700 per millimeter. Largest kidney-shaped nucleus. So the shape of the nucleus, it is like the kidney. So this is the morphological difference between the cells that we are seeing in them under the microscope. Homeostatic imbalance in case the white blood cells sometimes are coming up in a huge amount, which is in case of leukemia. Leukemia, it is the cancer of blood, cancer of white blood cells. So the blood cells are formed in a huge amount. And in this case, mostly it is immature cell. If the cell is immature, what's the meaning of immature? What's the meaning of immature? What we mean by mature, طيب?
More than?
Huh? For the human being, when we say that he is mature or immature. Huh?
Sick or
No? No. It is not the sickness. Mature, it means fully formed. Fully formed. If it is fully formed, it means that it's able to do all the function. mature نحكي بالغين بالنسبة بالغ يعني قادر. نعم. يعني لما يكون الإنسان بالغ معناه إنه من ناحية عقلية وجسدية هو قادر على اتخاذ قراره واتخاذ فهذا الماتوريتي. لما نقول إنه فلان he is more mature, it means that he is able, he is having the wisdom, he is having the ability to take the action. When the cells is immature, it means that it will not be able to perform its function. When it is mature, it means that it has the ability to perform its function. When it is immature, it means that the ability to perform the function, it is either less or it is nil. In labor, we say that she delivered an immature baby or premature baby. Premature, it means that خداج, still he is not fully developed before coming out. Did you understand what is the meaning? Yeah. So he is in need for some help. He is unable to breathe well, to suck, and here the white blood cells. In case of leukemia, it is a huge number of cells, but it doesn't work properly. Or the amount of the cells that can work, it will be very less. So it will not perform its function. So a huge number of immature white cells produced by cancer of bone marrow result in poor. The main function of the white blood cells is what? What's the main function of white blood cells? It is defense mechanism. Yes, thank you. So it is the defense mechanism. So when it is immature, it means it will not defend our body. It will not protect our body from microorganisms. So because of that, there will be some signs and symptoms that we might see in that person, that swelling in the lymph node, fever will be there, and abnormal leukocyte, the amount of white blood cells, it will be very high. So this is the in case of leukemia. We will study it later, so we will not go deeply within this. To list the white blood cells in order or balance in blood, use the phrases which is never let monkey eat banana, the neutrophil, lymphocyte, monocyte. This is the first, in order to remember the type of white blood cells. So you can use this statement, just it will give you the first letter of each type of blood cells. So never let monkey eat banana, never from neutrophil, let lymphocyte, monkey monocyte, eat eosinophil, banana basophil. So this is to make you able to remember the types of white blood cells. Characteristic of form elements of blood cells. The erythrocyte or red blood cells, as we said, the occurrence of it or the amount of it within the cubic millimeter, it is 4 to 6 million. Smaller or colored by caved disc. It is unnucleated, as we said before. It doesn't have nuclear. Little sac of hemoglobin. So it has, most organs have been ejected, so it doesn't have molecules inside. The main function of it is transport oxygen-bound hemoglobin molecules, also transport small amount of carbon dioxide. The rest of, or the main transport of carbon dioxide is through the plasma. But a little amount will be transported back by the red blood cells. Then we have the leukocyte of white blood cells, and the amount we said that from 4.8 to 10.8 thousand. The main component is the neutrophil from 3 to 7,000 per ml. The cytoplasm stain pale pink and contain fine granules, because this is from granulated cells, which are difficult to see them, those granules. Deep purple nucleus is there, consists of 3 to 7 loops. So it might be 3 to 7 loops of that nucleus. So the function of it, active phagocytosis. So the main function of the leukocyte is phagocytosis. Number increase rapidly during short-term or acute infection. So in case of acute infection, the number of leukocyte, it will be increasing dramatically in order to fight against infection. So it will lead to phagocyte. Phagocyte means that it will engulf the microorganism and it will take it inside and ingest and digest it and destroy the bacteria. The eosinophil we will take later, also the immune system when we are taking the lymphatic system, so we will come back also to the white blood cells again. So the next chapter after blood will be cardiovascular, then lymphatic. In the lymphatic we will come back also to the characteristic of white blood cells and how they are doing. The eosinophil, as we said, it is 1 to 4%. Red coarse cytoplasmic granules are there. It is the figure of 8 or bibold nuclei. So it is a bibold two nucleus, or it will come as a figure of 8. The function of it kill parasite and worms by so digesting them with their enzymes. So each type of white blood cells, it has its own specific function. So the granulocyte, it will engulf the bacteria or the dead cells, or even any infectious material, any abnormal cell can be engulfed by the, so it is for general immunity. The eosinophil, it is specific for the worms and parasitic infection. The basophil, it is from 0 to 1%. Cytoplasm has a few large blue purple granules are there. U shape or S shape, as we said, nodules with constituent stain dark blue. This is the nuclear. It will release histamine. The release of histamine, it will lead to dilation of blood vessels. So from the function of it, it will release histamine. So it is a chemical substance that it will lead to vasodilation in the site of inflammation. Because of that, when there is an injury, when there is an infection, you will see that redness will be there, hotness will be there, and pain due to swelling. This is due to histamine release, either local or general. So when it is released there, it means that accumulation or fluid will be there in order to wash out the infection, in order to get rid of the cells that is deteriorated. So contain heparin also and anticoagulant. So it will prevent the coagulation also. The other two types, which is the granulocyte, lymphocyte and monocyte. The lymphocyte, as we said, it is from 20 to 24% of white blood cells. The cytoplasm is pale blue and appear as thin rim around the nucleus. It is a very thin rim here around the nucleus. Spherical or slightly indented or dark purple blue nucleus. So the nucleus is very dark purple. The function of the granulocyte is a part of immune system. One group or B lymphocyte produce antibody. So from the function of it, it is the production of antibody in our body. Other group, which is the T. So we have B lymphocyte and we have the T lymphocyte involved in the graft rejection, fighting tumors when tumors are there, and viruses via direct cell attack. So it will attack the cell directly. Graft rejection here in case of organ transplant. في حالة اللي زرع الأعضاء أو tissues. The monocyte also, it is from 100 to 700. It's from 4 to 8% of white blood cells. Abundant gray blue cytoplasm is there. Dark blue purple nucleus, often which is like a kidney shape, that nucleus within it. The function of it is active phagocyte that become macrophage in the tissues. So when it escape out in the tissues, it will become as macrophage. Macrophage, it means that it will engulf the bacteria or the deteriorated cells. So increase in number during chronic infection. So it is mostly here in chronic infection, not in case of acute infection. Such as in case of tuberculosis. So if we find that monocyte is more in the blood of that person, it means that he is having a chronic infection, one type of chronic infection. Then the last thing, it is not from the white blood cells, this is the platelets. This is from the four elements of the blood. It is from 150,000 to 450,000. It is essentially irregular in shape, cell fragment, it is stained deep purple. This is the color of it, it's the deep purple. Need of normal blood, so it is for normal blood clotting, initiate clotting cascade by clicking to a torn area. When there is an injury, so it will be clicked in that area and it will form a clot. It will, with the help of the plasma protein, that will be changed to fibrin, and it will be clotted there and close the site of injury. So it is there with that, and there is a vitamins also which help in the, when we come to the clotting, there is a vitamin also which will help in clotting. What's that vitamin, if you remember, in biochemistry? Vitamin K, yes. Thank you. So the blood cell formation, or what we call it the hematopoiesis. Hematopoiesis, which is the formation or manufacturing of the blood cells. How the cells are formed. Where are the blood cells formed in our body? In which side? In the bone. Which part mainly of the bone?
Red marrow.
Bone marrow. Which type of bone marrow?
Red
Red bone marrow. The red bone marrow, where is it present, in which type of bone or which part of the bone? Long bone, in which side of that long bone? Is it in the shaft or the?
Deep.
Huh? The channel, in the channel. What's there in the channel of the red bone?
Endocytes.
The long bone. When you are broken the long bone, inside it, what do you find? Huh? بالعيد لما بتكسروا العظام. Inside the long bone, what do you find?
Liquid.
What's that? This is the white bone marrow. It's not the red bone marrow. The red bone marrow, it is present in the both head of the long bone. If it is in the long bone, it is present in other bone, in the flat bone. So if you are taking the sternum, and if you cut the sternum of that goat, or you'll find that it's red from inside.
Yes.
But if you are cutting the long bone from the middle, from the shaft, you will find that white bone marrow. So this is the difference. The red bone marrow, it is forming the blood cells. So the hemoptysis or the process or the manufacturing of red blood cells, it is occurred in the red bone marrow or what we call it the myeloid tissues. All blood cells are derived from common stem cells, which is the hemocytoblast. Hemocytoblast. So in the red bone marrow, there is the hemocytoblast. That is the mother cell of the blood cells. So the blood cells are coming out from that hemocytoblast in the cells. So hemocytoblast differentiate into two types: the lymphoid stem cells, which produce the lymphocyte, and myeloid stem cells. So it is divided to two types. Myeloid, it will be divided to myeloid and lymphoid hemocytoblast. The myeloid stem produce other form element of the blood, but the lymphoid stem cell, it is producing the lymphocyte only. So lymphoid, only lymphocyte. The myeloid cell, it will produce the erythrocyte, it will produce the platelets, it will produce the other white blood cells and the red blood cells. So it is present in the head of long bone and also in the flat bone. So the spongy part of the bone, it is present there. In the spongy part, you will find that inside the spongy part, it is, if you cut it, it is red in color. So the stem cells here, or the mother myeloid cells, it will lymphoid and myeloid, lymphoid lymphatic cells, and the myeloid cells, it will produce monocyte, neutrophil, erythrocyte, and platelets to other white blood cells and red blood cells. The formation of red blood cells, as red blood cells are unnucleated, they doesn't have nuclei, they are unable to synthesize protein and or grow or divide. So it cannot be divided, it cannot be grown. As they are, red blood cells become more rigid and being fragmented or falling apart within 100 to 120 days. So the lifespan for the red blood cells is from 100 to 120 days. After that, it will be defragmented and it will die. Their remains are eliminated by phagocytosis in the spleen, so it will go to the spleen and it will be extracted there, and in the liver and other body tissues. Lost cells are replaced by the differentiating hematopoietic or bone marrow. So it will be, the bone marrow will be manufacturing red blood or blood cells every day, every minute. There are some cells which is produced and cells which die. So it doesn't mean that the body every 120 days it will start to form blood, and during that period he will be taking rest. After that cells will die, he will start. No, it is a continuation. So every day there are millions of cells which destructed and millions of cells from red blood cells and white blood cells are formed in our body by the bone marrow. So the development of red blood cells divide many times and synthesize hemoglobin when it is enough. The nucleus or the granules are ejected and the cell collapsed inward in the bloodstream. So the resting cells are reticulocyte, are young red blood cells or RBCS, have some endoplasmic reticulum. So they enter the bloodstream within 2 days and release. They have ejected the erythrocyte and become fully functioning erythrocyte. So the erythrocyte, when it is formed, it will be formed as RBCS. Then it will be within 2 days. It will be a fully mature red blood cells. It takes 3 to 4 days to become a fully mature hematocyte or red blood cells. The production is controlled by erythropoietin. Erythropoietin, it is a hormone produced by the kidney and the liver. So when we are coming to the patient who are having renal disease or end stage renal disease, the ability of them to produce red blood cells, it will be affected, and because of that, they might have, in most of patients who are having a kidney problem or chronic renal failure, they are having anemia because of lack of erythropoietin. So they are supplying them by erythropoietin from outside by injection in order to maintain the process of formation of blood cells. We'll stop now.